I'm Dr. Bob Jacobson with Mayo Clinic. I'm Chair and Professor of Pediatrics, and I work in the Vaccine Research Group here. I'd like to talk to you today about which vaccines are required and which ones are recommended. It's a common question that comes up with parents, and I think as we develop very effective and safe vaccines for children, we keep adding to the routine schedule, and it can become confusing. For example, many parents think of the diphtheria, tetanus, pertussis vaccine as required, whereas they see the newer vaccines, such as a human papillomavirus vaccine for teenage females, as optional. That's not the case. Actually, the federal government does not require any vaccines for children. At the state level, the state may have decided for daycare or school attendance that parents must either vaccinate their children or sign a written refusal, such as a religious or conscientious objection. But at the federal level, we don't require any of the vaccines. They're strongly recommended, and in fact, the human papillomavirus recommended for female teenagers to prevent cervical cancer as adults is just as recommended as the tetanus vaccines that we give infants. We are very careful to use the routine recommended childhood and adolescent vaccine schedule as promoted by the Centers for Disease Control and Prevention, the American Academy of Pediatrics, and the American Academy of Family Practitioners. This schedule is a harmonized one where the three groups have gotten together to review the evidence, the safety data, and the risk data for the diseases the vaccines prevent, and put together a schedule that makes sense and works well for children and teenagers. That schedule comes along with vaccine information statements that are given to the parents at the time of the vaccines that can help answer questions such as, why is this vaccine needed? And is this vaccine appropriate for my child? And what are the safety concerns? Our vaccine schedule has worked incredibly well, and many authorities look at the 20th century as the golden age for vaccination, where we dramatically reduced or eliminated a lot of harm from vaccine preventable diseases such as measles, mumps, pertussis or whooping cough, diphtheria, and diseases we don't often hear about now because of the vaccines, polio and smallpox. In fact, we no longer vaccinate against smallpox because we were able to wipe out that disease with routine childhood vaccination. We have the same hopes for polio and someday for measles as well.